everybody, how's it going? This is Andrea back again with another update for the New York Health Act. For those who still don't know, the New York Health Act is a state-level single-payer bill which would insure each and every resident in New York for every medical necessary procedure, which would include primary, vision, dental, mental, long-term, you name it. How is everybody doing? So let's get straight into the update, by the way. A legislative update, again, cannot emphasize this enough. People need to get in touch with their legislators via phone, email, social, however you do it. I've left their contact info below. And if you're active on Twitter, make sure you check out the Twitter threads that are tagging each and every New York State Assembly person, New York State Senator, the governor, all of them. So make sure you're tagging all of them so that they get a notification and they know that this year they need to pass the New York Health Act. It is an urgent need, no matter what year it is, no matter what day of the week it is, no matter how far or how near we are. This urgently needs to happen for everybody who needs health care. For the community update, which is my favorite part of the update, because if the community moves, the legislation moves much quicker. And this is my favorite part also, because this is where things really move forward. If the community knows that healthcare is a human right, that's where the legislators, because no legislator can pass any legislation without the public support needed. They are not leaders, they are listeners. They are hired, they are elected to listen to we the people. So we need to be as loud as possible about the New York Health Act on social media, in our friend circle, no matter where we go. If we are religious, in our churches, in our temples, wherever we are, we need to advocate for the human right of healthcare. So make sure that you are doing that to any way that is possible for you. And no matter who you are, you can tweet out support for the New York Health Act. You can add your voice to the New York Health Act simply because it is the first step. Once we accomplish the New York Health Act, of course it is going to ripple through the entire country. So make sure that you advocate for the New York Health Act in your day-to-day life. And a great way to do that is obviously to add a red apple next to your name. Make sure you do it. One can also join great organizations like the New York Health Campaign. The Campaign for New York Health. Yeah, they use those interchangeably, but it's basically Campaign for New York Health, PNHP New York Metro, and New York City DSA, who have upcoming events actually on 30th Jan. So make sure you check those out. There are so many great organizations who have done so much to move this forward. I remember last year, the caring majority got long-term care into the New York Health Act. So this is about we making sure that we are all well taken care of. It's a beautiful thing. So make sure you're a part of it. Last but not the least, going to plug in some articles and some tweets. Definitely going to plug in a tweet that New York City DSA put out calling out Senator Andrea Cousins, because she and Heastie need to put the New York Health Act on the legislative calendar. So make sure if you are in their district, or even if you're not, tag them and let them know that they need to put the New York Health Act on the legislative calendar. And I'll obviously leave the link to the article written by Assemblymember Richard Godfrey about why we need the New York Health Act, whether it's 1992 when it was introduced or in 2021. So every day we get closer, and every day is a win in order to guarantee health care for each and every one of us.